I'll yield to Senator Tuberville.
Thank you, Chairman Tester and ranking member. I'm from Alabama. We're very proud of the VAs that we have in our state, and we've recently had a new one put in. It's a clinic. Very, very proud of that. I've got some friends that have had some relatives in there, and they're doing a great job. And I think it's our sacred duty to take care of our veterans. I believe most people at the VA try to do that every day. I know since I've been on this committee for 3 years, we've worked awfully hard to make our VA better. But the fact is that we've had some abuses going on for a long time, and we all know that. I mean, it happens in every hospital, but we've had some happen in the VA, and we're responsible for that. And we knew that during the Obama years. We had veterans dying on waiting lists. VA's employees lied to cover it up. It was horrible. I mean, I read some of the statements, and I mean, you just can't fathom that. It's an insult to everybody that wears a uniform to have to go in some of these places. So these people needed to be held accountable. Frankly, a lot of them should have gone to jail for what I saw. When President Trump took office, he addressed this problem head on. A bipartisan Congress passed the VA Accountability Act. It passed by voice vote in the Senate, overwhelming in the House. It allowed the VA to fire 4,000 employees. Now, I wasn't here when that happened, but that's just amazing to me. 4,000 people were fired basically for not doing their job at the end of the day. And they were fired for cause. Now, these weren't layoffs. These were people that just absolutely either did a terrible job, didn't care about what they were doing, and they got laid off. And this is exactly what a bipartisan Congress intended to do, is get this straight. These people have no business getting a paycheck from the taxpayers. It's absolutely criminal. The law is still on the books, but for some reason we've reached a settlement. Somebody's reached a settlement with trial lawyers, and we're not enforcing this anymore. The law is still on the books. This is not how the Constitution works. Last time I looked, we pass a law. We're supposed to go by the law. I mean, this has been in the playbook for a long time on the left to try to make this work like this, and we can't do it. I mean, we keep trying to make the VA better, and we're making it worse. I mean, we're not making any progress here. We saw under President Obama that things would change. We thought they would change. It didn't change. Arguably, it got much worse. So now we've agreed to give free money to people that didn't do their job. It's mind-boggling to me. I mean, we take one step forward and 2 steps back. This can't be how the system works. I mean, that's not the reason I ran for this job, and hopefully the reason that you're not doing your job. Veterans need help, and it's obviously we all know it's the biggest healthcare system in the world. The VA is the biggest healthcare system, and it's hard. Understandably, it's hard. But now, in my state of Alabama, we have 74 people who were fired for cause, not laid off, and now they're getting their jobs back. And I've heard some horror stories about what some of them did. And it's embarrassing to me now to talk to veterans about the situation that we got ourselves in, try to get ourselves out, now we're back in it. So it's no secret that it's getting worse. And we can't continue to do this. I don't care, what we got to do, we got to make it better, but when we make a law, we got to go by it, and we got to make it work. So, Ms. Theriot, I want to believe that the VA is hiring only the best and the brightest employees, and we all want that. Sometimes you don't know what you're getting to serve our veterans. But as many of us have discussed since I've been here for 3 years, we know not everybody in the VA is going to be exactly what we want. So how does the VA plan to protect its veteran patients from this grievous misconduct if we're not going to go by this Accountability Act? How are we going to do that?
So, Senator Tuberville, I acknowledge that we want the best working at the VA, and we want to protect the rights of veterans. And we do have authorities that allow us to take adverse actions. I mentioned in my opening statement that since 2021, we have not been using 714 for American Federation of Government Employees because we were found to have not bargained impact and implementation with them. We have used our existing authorities for performance and conduct actions under Chapter 43 and Chapter 75, and we continue to take over 4,000 adverse actions, which are removals, demotions, suspensions of more than 14 days. So we have found the opportunity to use the existing authorities that we have to hold employees accountable. I do acknowledge, and I don't want any views on these bills to indicate that we are happy with the status quo or we don't see opportunity to improve and do better. We know there's still inconsistency in how actions are executed in the field. We know that things still take too long, and that's why we want to work with this committee on something like the LEAD Act, where we can look at those policies and procedures that we take prior to proposing an action to make sure that we have evidence, as the chairman had mentioned, that is thorough, that is timely, and affords employees due process. So at the end of the day, we are able to remove those employees who should not be working for the VA. We also just completed a record year of hiring, and we are learning from the authorities that we received in the PACT Act how to hire more effectively and efficiently. So with that, we're looking at making sure that we have employees who are committed to those who have worn the uniform, and that we are able to remove those with performance and conduct issues at the earliest point we see those issues.
These 4,000, will we have any special oversight? You know, they did something wrong at the beginning. Now, you know what I'm saying. I mean, somebody's got to be held accountable, because if this happens again, we have people lose their lives. My goodness.
No, absolutely agree, Senator Tuberville. And what I would say in the settlement that we reached with the American Federation of Government Employees that impacts about 4,000 employees, we do have a provision in that settlement agreement that allows us to repropose the action which the FLRA determined was not taken lawfully because we didn't engage in impact and implementation bargaining. So even though that action taken under 714 we could not sustain, we can look at actions and retake them under 43 and 75 and continue to make sure that individuals who should not be working in our medical centers are removed for the reasons that they shouldn't be working there.
Well, hopefully they start with 2 strikes, you know, and not get 3 strikes. Thank you, Mr. Chairman.
Senator House.